We all know that early detection for signs and symptoms are steps taken for disease prevention. However, can the same be said for prostate cancer?
Prostate cancer can occur in an early stage or a late stage. In the early stage, prostate cancer has no signs or symptoms, which means a man can be suffering from early prostate cancer without even knowing it at all. In the advanced prostate cancer stage, the man may suffer from typical cancer symptoms like loss of weight, loss of appetite, pain in his bones. But unfortunately, at this stage, it may be difficult to cure this person. Hence, I would emphasize that we should try to detect all prostate cancers in an early stage. We can depend on a blood test that is very commonly done and readily available in almost all laboratories in the world. This blood test is called PSA, also known as Prostate Specific Antigen. If it exceeds the normal level, then there is a suspicion of prostate cancer. This person will then need to be referred to a specialist, a urologist, who will perform MRI scan of the prostate or ultrasound of the prostate. Following these procedures, the doctor or urologist will then take a sample of the prostate tissue by doing a prostate biopsy. Upon detection of early prostate cancer, we would then go on to stage the disease. Staging the disease means we want to know whether the disease is limited to the prostate or has the disease spread to other parts of the body, such as the lymph nodes, the bones, the liver, or the lungs. We can do a scan like a bone scan, or more recently available, a PSMA scan. PSMA standing for Prostate Specific Membrane Antigen. This particular PET scan detects prostate cells all over the body, which means even in the most minute or small amount of prostate cancer cells in any other parts of the body other than the prostate, we would be able to detect it with a PSMA scan. If it is confined to the prostate, we can potentially cure this patient. We can offer the patient a surgery to remove the entire prostate, or we can offer the patient radiation treatment to irradiate, to destroy the entire prostate along with the cancer cells.
We often associate major surgeries with long hospital stays, massive scars, heavy medications, and side effects. However, thanks to innovations in the prostate surgery, men do not have to go through such a hassle anymore.
In the robotic surgery, instead of making a long cut in the lower part of the tummy, we substitute it with 6 tiny holes, each hole measuring between 5 millimeters to 1 centimeter, which means this causes the patient much less discomfort and pain after the surgery. They have a shorter hospital stay, less requirement for painkillers after operation, and almost no blood transfusion required. The surgeon looks through with a special 3-dimension camera. With a 3-dimensional camera, the surgeon can appreciate depth, which is very, very important when we are operating in a deep structure such as the prostate. In addition, by using the magnification power of the robotic camera, the surgeon can view structures at 10 and up to 15 times magnification. This helps us identify important nerves to preserve, important structures to preserve, so that we have better outcome after surgery. With robotic surgery, we are able to achieve better cancer control, better cure rate for cancer, in addition to better continence after surgery and lower chance of erectile dysfunction after surgery. So much so, in the last 8 years of performing robotic surgery, almost 100% of our patients are totally continent after surgery, which means they do not leak urine at all. And a fair or good number of our patients have good erectile function after surgery. In some of them, without satisfactory erectile function, they are still being able to be treated with medications such as Viagra-like medications. Prostate cancer is an extremely common cancer in males. In many developed countries, like Singapore, this is the commonest cancer amongst men. In Singapore, it is the fastest rising cancer in men. I've been asked many times by my patients, what can we do to prevent prostate cancer? What are the causes of prostate cancer? Unfortunately, up to today, there is no obvious cause to prostate cancer. There is no clear link between alcohol consumption, tobacco smoking, to prostate cancer. The clearest link that we can hear or we can see for prostate cancer is that it may be a genetically linked and inherited condition. Hence, we warn our patients who have a family history of any form of cancer or family history of prostate cancer that they have to start prostate cancer examination or surveillance from a younger age of 40 years and above. And the process of detecting prostate cancer is not difficult. This group of higher risk patients will undergo a yearly PSA blood test.
Thank you for watching this episode on the prostate. If you have any medical inquiries, please feel free to contact us and we'll be sure to assist you.